In thinking together about congestive heart failure, we want to know the 4 different classes that mark congestive heart failure, and then we're going to talk about some of the causes of it and some of the symptoms in recognizing it. So we begin then with class 1 of congestive heart failure. At this level, a normal physical activity and symptoms that go along with congestive heart failure produce no limitation in normal physical activity. So we'll say class 1, they have congestive heart failure, but there is no limitation in their normal physical activity. Class 2, they start to recognize more marked symptoms during normal physical activity. These symptoms would include fatigue, dyspnea, and other symptoms like that. So normal physical activity for class 1, there's no limitations whatsoever from the congestive heart failure. Class 2, normal physical activity results in fatigue or dyspnea. Class 3 is marked limitation. In normal physical activity, the symptoms become so pronounced that even normal physical activity becomes almost impossible. And then in class 4, basically the symptoms of congestive heart failure are experienced with minimal activity and even at rest. This, of course, being the worst class, that they're not doing anything or they're doing very minimal activity. Any activity whatsoever, even resting, they're experiencing the effects of their congestive heart failure. Very serious class here. So class 1 congestive heart failure, doing normal activity, they might experience some symptoms, but there's no limitation in their normal activities. Class 2, normal physical activities result in fatigue and dyspnea. Class 3, strongly marked limitations in their ability to do normal physical activity because of the symptoms. And then class 4, they even experience the symptoms when at rest. Very serious. And then when we think about causes of congestive heart failure, we need to think in terms of coronary artery disease, cardiomyopathies, endocarditis, extracardiac infections, and pulmonary embolus. All of these can lead to congestive heart failure. And some of the symptoms to recognize someone in congestive heart failure would be cold or cyanotic skin, wheezing, mitral valvular deficits, lower extremity edema, pulsus alternans, and hypertension and tachypnea. All of these are symptoms to be noticed going along with congestive heart failure. And I want to go over those again just to make sure if you were taking notes, you want to get these down. So remember the 4 classes of congestive heart failure. Class 1, very low level. There are no limitations that they experience or feel in ordinary physical activity, though they might experience some of the symptoms. No limitations. Class 2, regular physical activity leads to fatigue or dyspnea. Class 3, very marked limitations in their ability to do normal physical activities because of the symptoms experienced. In Class 4, they experience the symptoms when at rest or with any activity whatsoever. Causes again, coronary artery disease, cardiomyopathies, valvular heart disease, endocarditis, extracardiac infection, and pulmonary embolus. Those are causes of congestive heart failure. And then finally, the symptoms indicative of this are cold or cyanotic skin, wheezing, mitral valvular deficits, lower extremity edema, pulsus alternans, hypertension, and tachypnea. If you'd like to learn more about this, read further, then please click on the link below this video and go to that website where you'll find an ebook available for immediate download.